as you guys know, I was scheduled to have the gastric sleeve vasectomy. What did I just say? Oh, God. Coming to you from my healing room today. And I just got, I noticed a couple of comments from someone flashing her name. Thank you so much, girlfriend, for watching my vlog and for asking the question about Contrave. I do need to, I've been kind of in a denial thing and just sort of whatever about it. But yeah, let's face it. I am definitely in a dramatic moment about Contrave right now. So a little bit of my history is that I was supposed to have the vertical sleeve gastrectomy back in April of 2016, April 21st. And a few days ahead, I decided to cancel the procedure. Yeah. And so since then, it's been an effort to lose the weight, but without the benefits of the tool that VSG gives you. So then what happened was I had released, I think, at maximum 47 pounds. And then I regained 20 of those pounds. And then I needed to see my doctor for a evaluation of my blood pressure situation, because NSV, my blood pressure is so much lower now. I feel that if I keep going at the rate that I'm going within the next few months or so, I should be off blood pressure medication. Yeah. Okay. So anyway, so I go in and I explain to him, that I didn't really want to be there right now because I had lost so much weight, but then I regained some weight, and I was trying to get the weight off again before I came and got on his scale. So he thought that was funny. And he said, there's another way, there's Contrave. Would you like to, so he tells me about Contrave. I go, I get the prescription, I fill it. It's $150. And I'm like, damn. And I also am like, I read the bottle and I'm like, I'm not taking a full dose of this. No, I'm not. And I'm a rebel like that anyway. I like natural things. I like, homeopathic, naturopathic type stuff. So I have a thing about medications of any form if I really don't have to. And let's keep in mind that one of the main reasons that I didn't do VSG after all was because I wanted to see if I could do it myself, if I could reprogram my mind I'm leaving out some stuff. I realized that I had never ever coached myself the way that I would coach someone else, which is part of what I do for a living, goal coaching, really. And I'd never coached myself on what would I. So all of a sudden I started to do that for myself, to coach myself, and have myself use the kind of tools that I would have somebody else use if they wanted to reprogram their mind to think differently, feel differently, and have a whole different relationship with food and their body, their weight. Because I have a relationship with my weight, and developing a new relationship so that I am okay with being at my natural weight. Yeah, but that's not what I'm here to talk about today. We can talk about that another time. Contrave. So I've regained. Now I'm taking Contrave to help me re-lose. And the first bottle, I totally dick around with it. You're supposed to get up to, you start with 1 pill a day, then 2 pills a day. And that's like a week of 1 pill a day. Then a week of 2 pills a day, 1 in the morning, 1 in the evening. And then a week of 1 pill in the morning, or 2 pills in the morning and 1 in the evening. And then a week of 2 pills, or forever, 2 pills in the morning and 2 pills in the evening. Well, I didn't want to ever get to 4 pills a day. I just didn't want to. I didn't think I needed to, and I just didn't want to. And okay. So I was taking like a pill now and then, once in a while, and I would not take some for a few days, and then, I'll take another one. That doesn't work. I want you to know that right now. I had to learn that. I'm happy to have learned that for you. Let you know that really doesn't work. And there's something first of all, your body gets like to me, I describe it as an ice pick to the temple type jab. That's the kind of head piercing pain. But it'll only be just like, bam, 1, and then that's it. But it's enough that I'm like, oh, oh my God. And that would stop me actually from taking it initially. I was like, oh, hell no. I just felt a thing in my head. I am not taking that anymore. Well, later I learned from my doctor that the reason that that was happening was because I did not have enough of it in my system. And when you don't have enough, the side effect, one of the side effects is a headache. And I'm sorry. I'm like, that's not a headache. That's some sort of like assault type thing for which somebody should be arrested. Anyway, so once I started to take regular doses every day, then I was okay. And I want to say that I dicked around with the first bottle. I made that first bottle last maybe 3 months or so, maybe longer. And then my doctor, I went to see him again for some reason, and he's like, okay, how about this time you just really really, dig in there. Take 2 a day. Take 2 a day for a week. Do it for a whole week. Can you do that for me? So I did that. He gifted me a bottle, which was great. Because did I tell you how expensive this is? $150 the first bottle. So then he gifted me one, and I really appreciated it. Once you get your first bottle of Contrave, you're supposed to register. Do register if you do get it. Register, and then your next bottles will be less expensive. And I've heard other people on YouTube talk about the subsequent bottles being as little as like $70, which is great. But I didn't register. So my second bottle that after the free bottle ran out, that would be my second bottle. Now I'm getting the third bottle. I asked for a prescription and he filled it for me. And I went, I got it, and that was $240 because I had not registered yet. So trust me when I say register. So I have since registered, and you're also supposed to get a free scale, and the scale is supposed to like talk to you. It's like a cheerleader. Be like, yeah, you lost a half a pound, that kind of thing. I need that. I need that. So I'm gonna get my scale, but wait. Here's what happens. So, the third bottle, I would say I really did it right. I would take no more than 3 a day. I didn't need to take more than 3 a day. One time, I think I took 3.5. So I took 1 in the morning, and then I might take 2 in the evening. Or I would take 1 in the morning, 1 mid-afternoon, and 1 in the evening. Or 1.5 in the evening. But I would just never take 4. 3.5 max. And for the most part, I didn't even do 3.5. But whatever I was doing was actually working. So I do want to explain that. Hey, this is too long, so we're going to do part 2. Contrave is a mind-altering substance. I was not having no vasectomy because that would be physiologically impossible. I mean,